We measure day 3 labs at the beginning of working with a woman, and then we'll normally check another 2 to 3 months into our program or working with a woman and making changes to see how that affects her hormones, depending on where we started. For men, we love to see and require a semen analysis, and not just a semen analysis, because I have received a semen analysis from one couple and was looking at it and I'm not recognizing any of these parameters. And so there are semen analyses that are done in certain locations that aren't a strict Kruger semen analysis. The strict Kruger semen analysis is now standard for the fertility world in analyzing sperm. So we want a strict Kruger semen analysis, and normally the best place for men to get those is at your local IVF clinic. Now, the ones I've worked with, the IVF clinics allow you, if most of them, if you have a referral from another physician, they will allow the man to come and give a semen specimen and do the analysis for a pretty basic charge and not require a full fertility workup and becoming a new patient with them. So for the man, we like the strict Kruger semen analysis is very important. And we look at various parameters on that. We want to look at sperm count, the overall sperm count. And we want at least 40 to 50 million are the numbers that we're looking at least. The higher over that, the better. And then we're also looking at motility and morphology. So motility, we like to see 40 to 60% or greater. And then the morphology, we like to see at least 4%, but closer to 10% is more ideal for natural fertility. For women, we require or we measure day 3 labs at the beginning of working with a woman, and then we'll normally check another 2 to 3 months into our program or working with a woman and making changes to see how that affects her hormones, depending on where we started. I mean, maybe we started and her hormones fall in all the categories and the parameters that we want. Fantastic. But day 3 labs include FSH, LH, estradiol, and we also like to get prolactin. And prolactin, we like to do that fasting. Another hormone we measure is AMH, but that doesn't need to be measured on day 3. It's pretty consistent throughout the cycle. So LH and FSH, we like between 4 and 7, and we want the LH to FSH ratio to be 1 to 1 or pretty close to 1 to 1. So it could be LH of 5 and FSH of around 5. And then estradiol, we like to, the ideal range is from 30 to 50 on that day 3 of the cycle. As you can imagine, the hormones vary a lot during the cycle, so that's why we want to measure right on day 3, or if day 2 or day 4 will work as well, depending on when a woman can get to the lab.
If you want to learn more about optimizing your health and your fertility, then follow me and subscribe to learn more.